Hi everybody, really warm welcome to you on this very rainy afternoon, or certainly here just outside Colchester it is. We're really thrilled so many of you wanted to join us today. So my name's Jo Wells. I've been a trustee of the Essex Community Foundation for about 3 years, I think, born and brought up in Essex. I'm also in my day job the director of a progressive charitable trust focused on young people leading change. And I'm also involved with Comic Relief and their social impact committee. So I guess it's fair to say that I spend a lot of my time reflecting on how funders can best serve the interests of their communities and be accountable to them. And so reading through the list of organisations that joined this webinar, it's amazing to see the range and breadth of both small and large organisations that Essex Community Foundation is funding. So I'm really thrilled to be here. I'm also particularly pleased that ECF has been doing this community listening project and asked me to chair today. I don't think funders can be truly effective unless they are listening closely to the organisations that they fund, striving to improve from what is often a place of real privilege as a funder, and most crucially, obviously, acting on what we hear. So to hold ourselves to account, I think we need to make space for kind of constructive debate and scrutiny and work in partnership with the sector. And I think that this initiative is very much the beginning of that. Just a couple of words about COVID. I mean, given the situation that we find ourselves in, and the huge underlying inequality it's exposing our communities, alongside the real fragility in terms of resilience of the voluntary sector. And now, of course, we're going into a period of further restriction, which is going to mean increase in hardship for a whole lot of people that I'm sure you're all working with and supporting. So this conversation and this kind of deeper engagement and trying to understand how we can be the best funder is really timely. We need to reflect on how we can use our money in the most impactful way. What is the added value that we bring to the sector? What do we need to change as well about how we work to make life as easy as possible for the voluntary sector? And we can't answer those questions without your help. So thank you for contributing to the survey and being part of this call today. So as Andy said, we'll have time for Q&A and discussion. So we'll move straight into our presentations for the next 20 minutes or so. So Andy from ECF will kick us off. And then we're really delighted that we've got Rachel Brett from the county-wide Essex Community Youth Volunteer Services here today, and Sharon Alexander from Tendring CVS, who will share their perspectives. So do ponder your questions as you're listening, and without further ado, over to you, Andy.
Thank you. Okay, guys, I'm going to share my screen with you. I've got a couple of slides. So hopefully you can see that, and I'm going to go through these. I won't take very long. I'm pretty new to ECF. I started just over 2.5 months ago now, during lockdown, and really pleased to be at least starting to have this conversation with many of you for the first time, even if it's over a webinar and I can't actually see you at the moment. But I hope that as we move forward, I'll be able to actually have much more contact with you, and we'll come back to that at the end of the webinar. So I just want to give you some key points I think that have come out of the survey, and just to say that we, out of just over 800 people that had applied to us over the last 2 years, we got 323 responded to the survey, which is an amazing for us. And thank you very much for those that did respond. I think it shows that there is a desire to have a connection, and we want to make sure that we build on that and strengthen that. What you'll see from the slide here is that 1 in 2 of those, half of those that responded were grassroots organisations that are under £50,000 annually a year income. which fits with the number of grassroots applying over the last 2 years. So we would have expected that. I think you will also see that 25%, although they're coping, they are starting to have real financial challenges. And again, I don't think that's surprising. And I think we'll come back to that on the next slide. I think the survey also shows, and I think this is probably really important to show, is that, and I was sure this would come out, is that the survey shows the amazing ability and determination of the voluntary sector and charitable sector in Essex to adapt and change to meet the challenge and the needs for their communities during COVID. I mean, that's very obvious. You can see that in the way that 2 out of 5 have modified the delivery model, 1 out of 5 have changed it completely very quickly. And we had to respond very quickly to the response of the voluntary sector during that time. The major issues facing communities, and I've had a few conversations with the panellists sort of leading up to this and with others. I think it's not surprising, but I think, as Joe has already mentioned, that with the potential increase in restrictions and winter coming, the issues of mental health, loneliness, income/unemployment, poverty, they're all very close, and I think they all are interlinked with each other. And also this access to support and services, and how do we actually get people into access those. So on my next slide, I think just to reiterate the really significant impact and the particular impact there has been on grassroots small organisations. They have been impacted disproportionately, which is very different to the 2008 sort of financial crisis, where we saw some of the medium and larger size organisations struggling. This has been a really difficult one for grassroots organisations. And it's really interesting that over the last 2 years, 70% of all the new organisations that come to us have been grassroots, which is sort of surprising, and you'd expect them as they start their journey. But nearly half of those, so 206 came to us since March. So it's been a very difficult time. And I think one of the key areas that they've been struggling with has been volunteering. And I know that I won't go into too much detail, because I know that both Rachel and particularly Sharon will speak about that. But I think it's something that's really a key issue, obviously digital and financial challenges. Because actually out of those 25% that were saying they were really struggling, 3/4 of those were from very small organisations. And it doesn't surprise me that the things that they particularly want is things around, both have said funding, both smaller organisations and other size organisations, but they particularly want support around managing volunteers, health and safety, and digital. Just trying to get my cursor to go on to the next slide here. I think, again, coming back to this point that organisations have adapted really well, and I think that there is a sort of caveat to this, in that lots of medium and large organisations have been able to cope really well with redesigning their activities, identifying community needs, adapting to digital, all those sorts of things. But I suspect as we move forward into the rest of this year and into the next financial year, we may see that more of those medium and large size organisations struggling with finances as well as with other areas. And what you'll see in the general organisations have the following needs, that theirs are slightly different. They certainly do have the digital, funding is there, health and safety is there, but they want more support in collaborating, and particularly around sort of the ability, obviously the ability to network and events has gone. So that's a big issue. I'll just come to the last slide for mine, which is about, we wanted to ask about how you and how people who have applied have experienced us, because that's part of this conversation. This is a conversation, and we felt that COVID, this point was really important to have this conversation generally about the impact, but also this, we want to then lead into something that moves forward. So the key areas are for us is that that smaller organisations are also struggling. You know, it's more difficult for smaller organisations to get funding from us. It's not that, or found it more difficult in the processes that we have. 2 out of 5 didn't respond or said it wasn't applicable to answer those questions about how they felt about our service. And I think that's something we've got to address, and how do we make people feel really comfortable about being really honest with us about the way that we provide our services. 1 in 2 agreed and strongly agreed that that the communication was good, that we were appropriate in the process, that things were timely, and that the new application process was easier. And actually that was the same for smaller groups as well, which we're really pleased about. But it does indicate to me that there is more work to do to make sure that we work with you, and particularly with smaller groups, to try and make the process as effective and as efficient as possible, and that it really engages and supports communities to take on this really important work at the moment. So that's the presentation from me on the survey, and obviously we'll happily answer questions later. We've just got to unshare, and then we can go back. Do we go straight into, if I go back, sorry, I've unshared and I should have just gone straight back into, hold on 1 second. There we go.
You kept brilliantly to time, Andy.
Good, I shall go on. I'm just going to share it so that we can carry on with the next slides.
Great, and we're going to hand over to Rachel. Rachel, I think you're on mute. Wonderful.
Hello, let me just start my timer. I'm Rachel, I'm the CEO for Essex Council for Voluntary Youth Services. We exist to support the voluntary youth services across Essex, whether that is training, advice, support, representation at lots of different meetings. That is what we're there for. And over this last year, we've done lots of listening projects with youth clubs around what their young people are feeling. And the most recent one that we've done has been all around COVID. So we did this digitally, and over 17 youth clubs, 200 young people across Essex took part in this survey with organisations from all over the place. So SEN groups, youth councils, cultural groups, Girl Guides, the Boys Brigade, lots of groups took part. It was brilliant. We asked them things like how they're feeling, what were the positives and negative things about lockdown, what technologies they were using, if lockdown had made them feel worried about the future, and how they thought adults could help. I will put the link to the report in the chat so that you can have a look at that in your own time, because it's worth reading, but I can't cover it all in the 10 minutes that I've been given. So some of the key findings from that report was that relationships was both the best and the worst thing about lockdown. Young people generally said that they were okay. They'd enjoyed increased family time that had been forced upon them, and made use of technologies that enabled them to communicate with friends and family virtually. A small amount enjoyed a decrease in bullying, thanks to not being at school. But on the whole, young people have actually missed real life school, they've missed wider family, and they've missed friends, and most importantly, they've missed hugs. 3/4 of those young people were worried about their future. Lots of the young people we spoke to were worried about exams being cancelled, about college courses not going ahead. They wanted to know what was going to happen, but nobody actually had any answers for them. Some were worried because online schooling wasn't working for them. They may not have had the resources, the know-how, they might be bored at home, or simply unmotivated to learn virtually without being able to properly communicate with teachers or other students in real time. They didn't like learning alone rather than together. Young people want to know what's going on and be included in decision making. This is no surprise, we all want to be involved. We just want to know what's going on. They don't want half answers and ifs or buts. They need a clear action plan that shows what will happen and how it will affect them if things go a certain way in the pandemic. They want to be involved in things that matter to them and be part of the answer. give them a bone. They are passionate and they can make a difference. And teenagers aren't created for social distancing. Trying to tell teenagers to social distance is like trying to tell toddlers to social distance. It's just not something they can do. Being stuck at home goes against a young person's state of socialisation. They're at an age where socialisation outside the home with their peers becomes more important in their lives, and being with family is how they process how they feel, how they find their current place in the world, and mostly is based on emotion. Technology has not been the perfect gap for filling this void. It's been okay, but it's also presented problems of its own. It could never fully meet any basic human need for companionship and connection. So what might this mean going forward? Rise in anxiety levels. The UM service have already reported rises in cases of anxiety among young people since returning to school. Youth groups are now able to meet face-to-face have also reported that some young people are not willing to come back yet because they are anxious about COVID or about simply meeting in real life again. The longer young people are away from their support services, or if they have to miss school again for a long period of time, then I fear that we're creating a ticking time bomb for our own mental health services. And I don't think I'm the only one who thinks that. In the voluntary sector, this means that we are also unable to cope with the increase in demand, and it might be something that as a nation, we're simply not prepared for. Anxiety, bereavement, socialisation issues, eating disorders, and much more will need to be addressed and actually funded properly. For some young people, at home is also not the safe space. And being back at school and youth clubs, for some young people, this may mean that they've seen a trusted adult for the first time in 6 months. This will also reveal safeguarding issues that have been hidden, as there's been a dip in safeguarding issues actually been reported over the last 6 months to police. Issues that would have been addressed, and young people in need that should have been receiving help and support, but have gone unnoticed because it's behind closed doors. Young people, for that real contact and relationship. We often characterise young people as those most comfortable with living virtually and engaging with friends on social media, but the findings in our report show that young people hugely value the physical presence of others, the hugs from family and friends. Young people need people, and they need people with them physically, not just virtually. The 2020 Children's Society report, which just was released this week, says that 15-year-olds in the UK are among the saddest and least satisfied with their lives in Europe, and that the coronavirus pandemic affected children's happiness due to the lack of choice that they had in life. COVID has had a massive impact on our young people, and I think we'll be seeing the repercussions for many years to come. Thank you. Yes, slide 2, Andy. So what impact has COVID had on the youth sector? Well, many have had to adapt to services online and producing resources. And this is the great thing about charities, because we can adapt quicker than larger statutory bodies, which means that we're great at responding to needs as and when we need to. Youth groups have met online and it's been working well. However, it has been working well, but however great Zoom is, no one hangs around on a Zoom meeting to talk properly. And if you do, you have to be prepared for the whole group to hear what you're saying, possibly with your parents in the background too. So, as I said, youth leaders have had little to no contact with some of those young people over 6 months. And having that relationship with trusted adults is really important. Having a safe space where you can grow and develop skills in an informal space outside of school with like-minded peers will have an impact on the young people that have missed out. Smaller organisations and those reliant on subs are struggling to survive, or they will soon if there is another lockdown. And theatres, choirs, residential centres are struggling to find a viable way forward. Many groups will soon be on their knees due to this lack of funding or being allowed to exist. Quite simply, if we let these youth organisations close, it will be hard to pick up the pieces for a long time. Generations of young people will miss out on the opportunity that being a part of a youth group brings. Youth leaders and young people are struggling with the changing guidance from the government. We all are, right? But at an age when you naturally question everything, it's hard to explain why the adults in charge of our lives don't have certain answers or ways forward, or why the constants in our lives are constantly changing because of new updated guidance. So, what do we think needs to change? Next slide, please, Andy. More listening to young people and those in the voluntary sector, and then get them involved in the solutions. Clear guidance, a sector that is recognised as investable, and funding that is flexible and focused on priorities rather than projects. I would love to do another Youth Voices report off the back of this, because this report was published in June and so much has changed since then. We had a cluster meeting the other day and organisations were saying that young people are even more anxious now than they were in June. They've seen a rise in their services. Some of the services are full up. Young people are feeling frustrated and angry. We need to understand why and to let them know it's okay to feel angry, because we often feel like that, it's okay. And in particular about funding, I think that when you exist to serve others, it's the outward bits that people see and that they're interested in funding. But it's the other bits where we need funding the most. It's an annual struggle as the CEO of a charity to convince funders that you need to fund your office and pay for heating. I would love to see funders interested in the long term of an organisation and who want to get to know us, to get to know our needs, the young people we're here for, and our priorities as an organisation. To receive funding for our priorities rather than the sexy short-term projects that result from priorities would mean more stability, an enhanced sense of purpose, and ultimately it would enable us to stay afloat in a crisis like COVID. Thank you. 9 minutes, 45 seconds.
Brilliant. So impressed by the keeping to time so far, so no pressure, Sharon. And some amazing insights there, as well as some really great challenges, which I hope we come straight back to in the Q&A, maybe for Andy, around cool costs, flexible funding, etc. But let's move on and hear from Sharon now. Unmute, Sharon.
Not a good start. It's very strange to be talking to a screen without knowing who I'm talking to. So welcome everyone. I'm Sharon Alexander, Chief Officer of Community Voluntary Services Tendring, a role that I've been in for decades. I've worked in the voluntary and public sector for decades, actually, covering roles in youth work, libraries. I was a police officer. In this role, I've been a non-executive director in the NHS, and I have set up several local charities. So what I'm going to do now is give an overview of the landscape in tendering. Next slide. So our coastline is known as the Sunshine Coast, and it is indeed. We've got many beautiful beaches and it's worth a visit. So just a little plug there for tourism and your mental health. It will come as no surprise that many people choose to retire here. As with any district, town, borough, village, neighbourhood throughout Essex, tendering is not without its issues, including one of having the highest, if not the highest, elderly populations in the country, and who by nature develop long-term health conditions and live in some of the most deprived wards in the UK, such as Jaywick Sands, Harwich, Clacton-on-Sea and Walton-on-the-Naze. So next slide. So the snapshot of what it's been like to live and work in tendering throughout the pandemic. At the start of lockdown in mid-March, CVST board members and senior staff made an outlined plan in two strands, one being to directly support the residents and the other to support the voluntary sector. There was a third strand, which was to support our most valuable asset, our staff team, but I'm not going to talk about that today. As with many organisations, we provided a multitude of services, all designed to keep people safe and at home. it quickly became clear that the lack of digital skills was affecting the elderly population most, a lot of whom didn't want to increase those skills. However, we did find some who did, and with that evidence, we secured lottery funds and launched the Healthier Independent Technology Project, HIT for short. It's on a small scale, but we're targeting elder people who've no access to IT, and it's already changing lives. We also found that older people were cut off and isolated, especially those who were shielding. Their confidence and feelings of loneliness were escalating. Anxiety was going through the roof. So in order to fix that, we set up a walk buddy scheme matching people who'd lost their confidence to walk with a volunteer buddy. We also signposted to our local age concern, Colchester and North East Essex, who set up a befriending scheme in response to the pandemic. Others who were isolated needed a sense of purpose. We asked them to make face coverings, supplying the materials, and then asking the public to donate. And the proceeds of that little project were given to local charities nominated by the mask makers. Some of them were the Ark, Home Start, and our local community centre at Harwich, called the Park Pavilion. Actually, it's in Dovercourt. That's very important. We were receiving calls for help with money worries, and we were able to signpost them to citizens' advice. In terms of supporting the VCS, we set up the virtual COVID-19 group at the start of lockdown. We met daily and then weekly, and now it's fortnightly. This provided a coordinated voluntary sector response to the pandemic. Those meetings have been invaluable and provided a vehicle for organisations to share information, expertise, and things like risk assessments, procedures, safety guidance, and products. We linked up a local business who had a huge surplus supply of PPE with 4 care homes who had joined our group, and we raised the issue of PPE to our local NHS, and then it went national. Many community groups closed, many community centres and village halls and others reduced their services. Don't know, where are we? We're still on that slide, don't worry. Many community groups closed, many community centres and village halls and others reduced their services. The voluntary sector landscape has changed, and so we produced a directory for mutual use. We realised we needed to identify the local sector's needs. So next slide. We sent out a survey in April, May. So the chart on the left outlines how the pandemic impacted on service delivery. What was clear was that 10% of those responded said they closed, or those that were able to respond. These were very small organisations led by elderly volunteers. The red area shows that over half of those responding reported they'd reduced their services completely, and just over a third reported they increased their services. These were mostly medium-sized charities as demands were placed upon them. The multicoloured chart provides an illustration of the current issues taken from our current survey, which isn't yet complete, so it's just an idea of where we're going at the moment. The issues facing organisations include volunteering, digital funding, and the challenges we've all got, and that is managing change on a daily basis. The pandemic is affecting all of us, as people need people, as Rachel outlined in her presentation. On a more positive note, the voluntary sector reported that being part of a VCS group, providing mutual aid to each other, has been essential. So, next slide, Amy. The most common challenges facing both community groups and residents are broadly the same, and that is money worries, mental health, domestic abuse, digital, and dealing with change. Recruiting and supporting volunteers for many reasons has been a challenge, because volunteers usually sign up to do one particular job, and because of the pandemic, many have shielded, many have taken the opportunity to reflect on their lives and make changes, perhaps change their volunteer position, go to another voluntary group. or didn't want to continue volunteering due to fear or many other reasons. So in conclusion, I'd say as a sector, we've survived and gone above and beyond, but the landscape has changed radically. The world would be a poorer place without its VCS. And so I'd like to finish on a positive note with a quote from the Dalai Lama. Our prime purpose in life is to help others. And that's what we're all doing in buckets. Thank you.
Amazing. Thank you very much, Sharon, and also perfectly kept to time. My video is coming. So that was brilliant. I think so much in those presentations, both really hopeful stories of the amazing adaptability of the voluntary sector, and just the sheer kind of range of different, work that you do, but also really sobering thoughts around, for example, the ticking time bomb of mental health, which I, working in the youth space, completely agree with. And I think there's some really interesting issues that you touched upon around how we manage change, and how we basically evolve in a rapidly, radically changing landscape. But also intergenerational issues, where you have older people who are affected in one quite distinct way, and then you have younger people hugely affected by disruption to education and other things. So it would be amazing if you wanted to put some questions in the Q&A box specifically, and if you would like them to be focused on any one of our speakers, then please say so. If not, it doesn't matter. There's some interesting reflections whilst we wait for some questions to come up in the chat. And if Andy doesn't mind, I'm going to pick on him as well to say something about core cost funding and longer term funding. As a seed was sown there by Rachel, and it's an incredibly important one. It's one we hear time and time again from the voluntary sector, and it's a challenge back to ECF, I think, which certainly ECF are aware of. So it'd be great, Andy, if you had any reflections on that.
Yeah, absolutely. I mean, not to sort of make it sound very sort of operational, but it's actually very clearly in our strategy. It's a really important area for us. I think that what the COVID throws up for us is to try and understand. So I think there's two aspects to this. One is we know that people having to sort of, in a way, sort of develop a project to get funding takes up time, and it's not necessarily the most effective way to support people. So we're very clearly committed to developing a way of, I think particularly what Rachel said about looking at how do we sort of fund outcomes and areas rather than necessarily projects. But we do also understand that, particularly from this evidence around smaller organisations, but generally across the board, that we've really got to look at how do we support core funding, which delivers the services. So it's not like we're not delivering things through that funding, but I think it provides that sort of level of security and support to people. I think that the information that's come back around the impact that's had on smaller organisations is how do we also support them in that sort of way when they sometimes are particularly working on a much shorter basis. So medium to larger organisations work on a longer term, and we need to support them in that way. But how do we also then support some of these grassroots groups that maybe want smaller amounts over a year or 2 or 3 years to start to build themselves up? So I think there's more to learn. And I think that's why I'm desperate for us to have these conversations and want to continue it after today, so that we can get all the insight to make the right decisions and how do we take that forward. I think the only other point I would say is that you have to remember that as a community foundation, we have 160 donors, different donors who provide funding to us and support sort of the activity that we do. And what we need to do is to try and bring together a lot more of those groups alongside the people that are sort of getting something from these projects and pieces of work, so that I think that we can drive the insight that we get from communities to support our donors making the right decisions about allowing us to move and helping us to move in that direction.
Okay. We've got a question from Matt King. If possible to unmute Matt, and Matt, if you don't mind asking your question so we get to hear some other voices.
Hello.
Hello, we can hear you.
Hello. Yeah, my question is probably quite simple, but it's probably a bit more complex. How do we ensure we build the resilience of the sector? So we know that really interesting observations from the panel. How do we make sure that the sector can support itself and support each other through this and through the future? And in the chat, I've seen quite a lot of comments about small charities versus big charities and accessing resources and that sort of thing. There is obviously a lot of expertise within and across the sector, both in the CVS and other organisations. So how ECF and other organisations work to help our own capacity.
Matt, it's a little bit hard to hear you, Matt. You're kind of coming in and out, but it's a question about how to support the resilience of the sector. Was there another part of it?
No, that's fine. That's fine.
And Matt, which organisation are you from? I should have said to say.
So Trust Links, we're a mental health charity in South East Essex.
Great. Sharon or Rachel, would you like to give us your thoughts on how we build resilience?
So that's a really good question. Building resilience in the voluntary sector is something that CVSs across Essex do all the time. And we do that through training, building skills, providing plenty of opportunity for organisations to come together, working with your partner organisations, always raising your profile so that charities that provide grants to organisations know who you are and what you do. It's very important when you're gaining funding to make sure that your profile is high. And also, you know, if you don't know where to turn to get the most appropriate grant for your service, then go to your local CVS.
Okay, Rachel, anything to add on how we get this question of resilience?
I think, sadly, building resilience is a constant thing that we have to do over and over again. We're never going to fix the issue of resilience in the voluntary sector. We just have to keep trying, because the reality is that we don't do it for a profit. We do it because we're passionate and we believe in what we are doing. And I think we're always going to struggle, but it's like Sharon says, it's knowing where to go to and to look for advice. There have been some good funding pots out there throughout COVID to kind of help, the Community Foundation being one, the National Lottery being another. There have been good pots of funding out there, and I think it's just a case of battling and keep going for what you believe in.
Yeah, it's difficult though, isn't it? And I'm very aware, as we fund a lot of organisations, how exhausting that battle can be. And I do think funders have quite an important role to play in that. So with that, because I think it's kind of related question, can we unmute Simon Presney, please? You had a question relating to collaboration, I guess. Andy, are you able to unmute Simon?
Oh, I thought I had. Let me try again. Yes,
Or
Simon's up there. I think
Simon's
Simon needs to unmute himself.
Okay, I can unmute myself. Can you hear me now?
We can.
Yeah,
Please say where you're from, Simon.
Okay, Simon from Age Concerned Culture North East Essex. We've had some excellent collaborations with the CVSs, and Sharon's been superb throughout COVID, and we're also looking at the next wave as well. So great to have been a part of that. Yeah, my question was, when the listening conversation started, I did hear of a theme about sort of working maybe in different quadrants across the patch in Essex around themed areas, and initiating sort of conversations around what's happening at grassroots level, gathering that intelligence, and then perhaps when a larger funder comes to Essex Community Foundation and says, I want to, let's do it in reverse, I want to put £2 million towards older people's services in North East Essex or in West Essex or what have you, that the Community Foundation was then going to be able to go, well, actually, do you know what, it's just had about £3 million worth of investment we've gone to market with, could we direct that more to children's services or young people's services, and kind of managing the market in that way. I wondered if that had been picked up as a stream, and if that was going to surface, because we're really, really keen for that. There's a real appetite for that to happen in the market.
Great question. Andy, I think that's probably one for you to kick off on.
Yeah, Simon, nice to meet you, and I'd like to catch up with many of the people on here that afterwards. Absolutely, Simon. I know that the community listening project had sort of started sort of last year in its infancy, and then was sort of at the end of last year, and was about to come sort of into fruition just as COVID hit. So this is the first opportunity. We felt it was really important to be able to share some of the experiences that we had gained for the survey, but also from other organisations on the impact of COVID-19. But this is the very beginning of that conversation, Simon, and I hadn't heard that particular comment, but that's exactly the sort of thing that we're looking to discuss with you, and this is the part of that sort of co-design of that. So if that's a sort of a geographical, looking at themes in the geographical approach is something that people are interested in, that's the sort of thing that we'll move towards, because we do want to be able to build that insight of communities and the charitable sector, so that we can respond to funders, but also not just to respond to those funding opportunities, but hopefully to respond to sort of those key stakeholders and influence some of those funders and also organisations that might support the voluntary sector, and understand its real importance, particularly in health and well-being of communities, and also, I think, building on assets of communities rather than just waiting for them to have needs. And I think that's really important, and people at that grassroots really understand those. So absolutely, Simon, that's one of the things, and I'll be coming back to you to have a chat afterwards.
That would be great. And just to give that some context, I guess some of the work that's going on within the NHS circles and the councils, which probably the medium or larger, charities are involved with, is about how we collectively turn the curve on loneliness, on poverty, on some of these key determinants, the wider determinants of health, and kind of working with different areas and sizes of organisation. In some places, a very niche small provider will give a much better service than a larger provider. So I would definitely welcome those conversations in North East Essex along our themes.
Excellent.
Yeah, really great comments. And if I could just add, because I do a lot of work with big national funders, I mean, I think there is undoubtedly more of a role for ECF and others in the county to champion the role of the grassroots organisations in the county to other funders. I mean, you'll be aware, and there's a lot of comments in the chat about National Lottery, that they have been given a huge amount of government money for COVID response, which they have absolutely struggled to get out because of their own kind of bureaucracy and etc. And they are looking, not National Lottery, but many large national funders are looking for vehicles that are much closer to, to the grassroots, as it were, through which they can provide their funding. So there's a strategic role that place-based funders like Essex can play, and I, your points about managing the market are well made. Anthony has got a great question about kind of non-COVID related needs and what's happened during this period in relation to COVID funding and organisations that are not directly responding. Be great to hear from you, Anthony, and maybe Sharon and Rachel may have some thoughts on this.
Yes, hello, I hope you can hear me. I work for a charity, I work for South End Coast Watch, which is part of a national Coast Watch institution charity with about 50 stations around the coast, keeping a visual watch over beaches and inland waterways. We have a lookout station at East Beach, Shoebury-Ness, which is a very busy beach for kite surfers, windsurfers, horse riders when the tide's down, and paddleboarders, and obviously lots of local and visiting families using the beach. We work with the Coast Guard, HM Coast Guard, and the lifeboat organisations. We're in the process of replacing our watch cabins, which are basically falling apart, and we had a lot of damage from stormy weather in 2018, and they're really not really safe to use much longer. We've been quite successful raising money up until the COVID problem came along, and really suddenly for non-COVID related causes, it seems that funding has kind of dried up. We're not allowed even to do, coin collections at supermarkets or anything like that. Is there any way that funders such as ECF are allocating any money for non-COVID activities at the moment?
Shall I come in there?
Yeah, please do.
Yeah, Anthony, nice to speak to you. We have had some sort of limited contact just before this. It was interesting. One of the things that came out of the survey was exactly this issue. So it is something that we are addressing. We have had to be to respond to local organisations dealing with a crisis situation that was in place during those early months of COVID, and potentially may come back. But we had to respond very quickly to that and to focus on that. I mean, we were having 21 applications a day, every day of the week. I wasn't here at that particular point, but I know the team were absolutely driven by that. But in the survey, it did come out that there were organisations that weren't necessarily, that were affected by COVID, but weren't delivering something to support people during that COVID in a COVID related way. And they were asking when was sort of business as usual going to come back again. And as a result of that, we did put out our update just about a week and a half ago that we were open for business as usual, as well as still responding to COVID. So Anthony, I think, put in an application. I'm sure one of our team will speak to you. But yes, it is something we need to make sure we balance, one, supporting people around COVID, but also making sure that the things that maintain normal life and things for the public of Essex are still available to be supported.
Okay. In the interest of time, because we've only got a few more minutes on the Q&A, if you don't mind, Siri, I'm going to read your questions and put them to Sharon and Rachel for some last thoughts. And also just to say, Christine, you have a question specifically around sport funding, and I'm going to ask if one of the team can come back to you specifically on that question. But Siri's questions are, do we think some organisations are too small and need to be aligned due to costs of running quality projects, capacity issues? And also, what's the role here in terms of governance and leadership, leadership across the county, I guess. So we'd love to hear Rachel and Sharon's thoughts on that.
Who goes first?
Sharon, go for it. You're on mute, so.
So I'm passionate about inclusion, and I think there is a place for tiny, weeny community groups, right up to the, large charities. They all have a part to play in our community. Our small groups were essential during COVID. It was the mutual aid groups that sprung up, purely volunteer-led, that were able to help their neighbours and the streets. A lot of those have gone now because that's the nature of emergency response. And then in terms of those small community groups that are related to themes such as older people or young people, absolutely there is a place for the small groups. And you have a point that governance plays a part in running those organisations, but that's what a CVS is for. We are here to support the small groups with their governance, with their policies. We provide health checks so that we can work alongside those small groups and enable them to run smoothly and efficiently by providing them with model policies and procedures and make their work easy for them so that they can be legal, be compliant and able to do the thing that they do well.
Okay, brilliant. Rachel, what do you think? Do you think we should be looking at supporting more mergers and bringing different groups together?
I mean, that's always an option, isn't it? And maybe if it's just a short-term option. But I think, like Sharon says, these groups were set up to meet a need in the communities. And then unless that need has disappeared, then there's still a need for those organisations. So it's trying to help them think about how they can maybe just exist in the meantime until they can get their funding and their support up to what it has been. But there are ways to do some things like partnership bids. I know that we've been working with you, Siri, in a partnership bid to do some detached youth work across Essex, and we've linked up on that bid with some local organisations. So there's things like that where we can think about how we can work together to show each other's best qualities and help each other to get through this period as well. So I think there is a need for greater partnership working, but also a recognition, like I said before, from funders that we might need a little bit of extra help during these times.
Okay, brilliant. We've got 5 minutes left. I can see that there are some other questions in the chat, and there are also lots of great comments. ECF will most definitely collate those and, you know, reflect and review on them. So do keep putting them in the last minutes if you would like. But I'm now going to hand back to Andy to just talk a little bit about the listening work moving forwards.
Yeah, it's I've sort of mentioned this already to Simon, and I think it's an important point that Suri brought up as well. I think that we have an opportunity. We work with a lot of organisations across Essex, small, large. You know, some 20% of the organisations that we have supported recently over the last 2 years have had an income of under £10,000, but some of them have had over £1 million as well. So it's really important about how do we support across that board. But what we want to do as part of the community listening project is to start to have conversations. I'm a great believer in co-design. I'm a great believer in making sure that we have the insight from organisations and from groups to make the right decisions. It's going to be really difficult. Last year we had, you know, nearly we had applications for £9 million worth of applications, and we were able to give, which was a record for us, nearly £5 million. So that shows you the demand. I can't see that demand going down. So it's really important that we start to have a conversation with, you know, with Sharon, with Rachel, with other groups within the county. And we have a few ideas. I think one of the ones that Simon has brought up is a really important idea. We were thinking that there might be some particular focus around things like volunteering. I think absolutely around governance and leadership, which we could do together. I also think that for us, as we develop and make sure that we are, one, helping to influence, but also being able to make sure that we support organisations in the best possible way possible, is that we were thinking of setting up some sort of advisory group which had different sizes of organisations to sort of feed into what we're doing. And I guess this is the first starting point of that. So the next thing for me will be to come out and have a conversation with people. I will be ringing people up. If you start a new job, the first thing you do is go out there and see everybody. I haven't had that opportunity, unfortunately, so I've had to be working on other things, but this was going to hopefully the first opportunity. So you've now sort of seen my face if I haven't seen all of yours, but I will be contacting people to sort of take the next steps. And as I say, there'll probably be potentially focus groups, advisory groups, possibly localities, and looking at some of those key areas that have come up around sustainability, core funding, around volunteering, leadership governance, but also I think with a real focus on grassroots groups and how do we support those.
Thanks, Andy. It's really amazing because the chat is really taking off and people are putting really rich comments, including some positive ones about the support that they've received from ECF, which is really heartening to hear. So we've literally got 2 minutes, bit of a stickler for time. There's plenty for us to take on board, and I think we always saw this as the beginning of what's going to be a much longer conversation, obviously, and a kind of more deeper and intentional engagement with the sector. I think ECF is very good at listening in certain ways, but actually making that count for something strategic and more structured moving forwards is what's going to help take, you know, at least our work to a different level. And I know what a deeply challenging time it is for the voluntary sector at the moment, but I guess I just wanted to end on a positive, because I think it's also got to be a time of opportunity. Without going into cliches, there's a lot of people who are suffering so much during COVID, but also, you know, it is a time for opportunity to rethink our grant making, you know, rethink how we work together, rethink some of the stuff you're talking about around collaboration, and kind of reimagining and holding on to the best parts of this amazing sector that we're in, but also being a bit creative about the future. So I guess just please reach out with your thoughts and ideas. Let the team know that you want to be involved. I know they would like you to. We'll close now, but I just want to finally say thank you so much to Sharon and Rachel for your contributions and your involvement today. Again, I feel like we just started to delve into some really interesting stuff, but let the conversation continue. And I wish you all a very pleasant evening.